Namaste, welcome back to my channel. Today topic is frequently asked NABH question and answer. So before going to question and answer, let us know what is NABH. NABH is National Accreditation Board for Hospitals and Healthcare Providers. Mainly they will look into the quality and safety of the patient and healthcare worker. What is quality? Quality is nothing but how good something is, beautiful or attractive, durable, meeting standards, healthy, value for the money, or how much satisfaction the person gets from the services. Quality is nothing but it is a value for the money. Now we are into the 5th edition of NABH standard. So there are some changes they made compared to the previous edition. So what are all the changes they made in a standard? In the sense, in a 4th edition there were 10 chapter, 105 standards, 683 objective elements. And in a 5th edition chapters are same, 10 chapters, and the standard reduced to 100, and the even objective elements also reduced to 651 objective elements. And changes in our chapters, so there are 10 chapters. So in that patient center chapters are 5 and management center chapters are 5. So all patient centered it is same, AAC, COP, MOM, PRE, HIC. So there is no changes in a patient center chapter. Only they made changes in a management center. 6th chapter was CQI, continuous quality improvement. So now they changed into PSQ, patient safety and quality improvement. And remaining are same, 7th ROM, 8th FMS, 9th HRM, and 10th chapter is IMS, Information Management System. So this is the changes made in a chapter. Now let us move on to the question and answer. So these are all the questions expected during audit. So vision and mission statement of a hospital. So maximum this question will be expected during a audit. So again the answer is based on a hospital policy, we can say. Even what are all the scope of services, this question also expected during audit. So again it is based on a hospital services staff can explain. Next question is patient rights and responsibility. This is also important questions during audit. So they can ask any of the staff regarding patient rights and responsibility. The patient rights are right to impartial access to care, right to respect and dignity, right to privacy and confidentiality, right to personal safety and security, right to know the identity and professional status of the caregiver, right to information regarding the diagnosis and treatment, right to informed participation in decision involving his or her care, right to consult with other specialists at his or her own expense, right to explanation of the need for the transfer elsewhere or continuity of care, right to be informed of the hospital rules and regulation, right to information on how to file a complaint, right to explanation for all items in the bill. Next is patient responsibility. The responsibilities are providing accurate and complete information about his or her medical complaints, past illness, hospitalizations, medications, pain and other matter related to the patient health. Following the treatment plan recommended by those responsible for the care. where action if you are refused treatment or do not follow the healthcare team instructions, paying their bill promptly, being considerate of the rights of other patient and hospital staff. Next important question for the receptionist. So registration policy. The registration policy is, first thing is patient approaches reception counter to avail consultation, and the second point is reception staff to check with patient whether it is patient first visit or subsequent visit. Next, patient information is entered in the software to generate UHID. Next is, if it is not first visit, reception staff enquires about patient demographical detail for the identification and tracking of old registration number. If registration number could not be tracked, a new registration number is given to the patient for consultation. So this is the registration policy. So this question will be asked for the reception staff. So the reception or front office staff must know the registration process and policy. Next question again for the reception staff or front office. How do you register unidentified patient? The answer is, in case of an unidentified patient is brought to the hospital, such an unconscious patient brought by stranger, an incomplete registration shall be done in entering the name as unidentified followed by a serial number. For example, first unidentified patient shall be written as unidentified 1, next one as unidentified 2, and so the UHID will still be generated for that patient and healthcare services can be provided. The incomplete registration shall be completed as soon as identification detail of the patient become available. So this is the policy for unidentified patient registration process. Next question again for the reception staff. What is the policy of admission? All patients who are to be admitted should complete registration process. Admissions are referred from OP department, referrals and emergency room. The doctor advice for the admission in the admission note or form for OP patient. Billing staff explain the traffic detail and availability of type of beds. Patient is admitted based on their choice and availability of type of beds. Every patient is provided UHID number at the time of admission. In case of unknown or without bystander, patient comes to hospital. All possible effort to be taken by the hospital staff to ascertain the identification of patient. If patient is unidentified, then the patient is to be shifted to government hospital through security department. Also police to be informed, or if admitted, the patient is be identified by the inpatient number till patient name is identified as appropriate. If the staff handling registration and admission needs to add clarification on the services provided by hospital, they should contact manager for necessary information. Next important question for the front office is, what will be the patient registration process in case of emergency? The answer is, registration shall be done by asking the patient or attendant to fill up the registration form in which basic details of patient is required to be filled. Help shall be provided to the needy patient in filling up the registration form. The form shall be signed by the patient or thumb impression will be taken. So during emergency, so necessary detail will be collected and patient will be admitted. Need not to waste any time for the registration. Only basic detail has to be collected by the reception staff to make a registration of a emergency patient. Next important question for front office staff is, how do you manage when non-availability of bed? Answer is, patient shall be offered a choice of patient rooms or beds. In case of non-availability of bed, the admission staff informs to administrator to decide on arranging or adding more beds within the available space or converting single room to sharing room, and the concerned treating doctor is informed this addition of beds should not exceed the sanctioned bed strength for the hospital by PCB. In the event of non-availability of the room of choice, the patient shall be counselled and given the available option of other category rooms for his or her selection. The concerned treating doctor to decide on postponement or cancellation of admission in coordination and counseling of the patient. So this is the mechanism or process will be followed when there is a non-availability of bed. Next question for the front office staff, policy on referral of patient to other center. The answer is, if there is no possibility of bed availability or if the patient is not agreeable to be admitted in another class, then the treating doctor is asked to possible defer the admission of the patient or refer the patient to another center. In case of transfer of patient in a life-threatening situation like those who are on ventilator to another organization, a doctor, especially ACLS trained staff, accompanies the patient. The ambulance driver, helper, male nurse, specially trained in BLS, or a doctor accompany during transfer for unstable patient to other organization. So this is the referral or transfer policy. Next question is, what is general informed consent? The answer is, general informed consent shall be taken from the patient after provision of information and cost estimation and after final confirmation of admission. This should be done as per general consent policy and in the standardized format. Next question is, what measures are existing to prevent child abduction? The answer is, all our hospital area is covered by CCTV. Watchman or security guard is available at gate. We are trained in code pink and will announce it if anybody tells us their child is missing. Question number 12. Whom do you consider as vulnerable patient? Answer is, old age, kids, blind, deaf, mentally retarded, leg or hip fracture, pregnant mothers, post-operative and etc. This all comes under vulnerable category. And question number 13. What measures do you apply when you see or come across vulnerable patient? So first and foremost thing, identify vulnerable patient at earliest, provide bedside real support, use safety belt in wheelchair and stretcher, inform the patient to call us for help or support, educate the patient and attender. Question number 14. In case of code red, how do you manage? So first and foremost things, the staff should know race and pass method. So race, R stand for rescue the patient, A stand for alarm, C stand for confine the fire and E for extinguish. Next is pass method. P stand for pull the pin, A stand for aim at the extinguisher nostril at the base of the fire, S stand for squeeze or press the handle, again S stand for sweep. So the staff should know the raise and pass method whenever there is a code red. Next question is, Where do you report or complain your problems or grievance? Answer is internal complaints committee like HR management grievance handling and sexual harassment committee. So for this committee will be intimated. Next question is what will you do in case of accidental needle stick or sharp injury and whom to be reported including BBF exposure? Answer is wash the site with soap and water. Don't squeeze and do not use any antiseptic solution. If splashes to eyes, then irrigate with normal saline and report to ICN, CMO or RMO. So this is the process has to be followed when there is a BBF or NSI. Next question is what is sentinel event? The answer is a sentinel event is an occurrence that has resulted in unanticipated death or major permanent loss of functions not related to the natural course of the patient illness or underlying condition. Followings are the sentinel events identified by the hospital. The list of sentinel events are wrong surgery on wrong part, adverse drug reaction, mismatched blood transfusion, baby tearing in an NICU, gangrene of the limb of the baby, aspiration pneumonia, displacement of joint due to malpositioning by the staff, occupational hazards, bed sore, hospital acquired infections, fall from bed, needle stick injury. So these are all comes under sentinel event. Next question is steps of BBF spill management. Answer is wear PPE, mark the area, put tissue paper on the spill, pour hypochlorite solution. We wait for 10 to 20 minutes. Remove the spill to yellow color bag. And next question is what step do you follow during high risk drug administration? The answer is we have displayed the list of high risk drugs. We have marked the high risk drug with a red color, double verify dose, route, time, double check with senior staff or doctor, and double signature of a staff. So regarding this high risk management, spill management and NSI management, I already made a video. So in detail of the policy you can say in my channel. Please go through with that. Next question is what are narcotic drugs? How do you dispose remaining used narcotics? So narcotics drugs are fentanyl, pethidine, morphine. Dispose remaining narcotic in running water in front of anesthetist and witness. After disposal, 3 staff, anesthetist, OT nurse and 1 more staff has to witness will sign in the narcotic register. And next question is what the different color of biomedical bin and what do you dispose in them? Red, it is meant for plastic. It is a recyclable waste. We can discard all rubber gloves, syringes without needle. Yellow, it is meant for soiled waste like dressing material and body parts. Blue, glassware and metal implants. PPC, all sharp waste will be disposed, and black, it is meant for general waste or non-infectious waste. So remaining question and answer will be explained in next upcoming video. Please watch my channel and support to my channel. Thank you.